is Ronald Weber, Waziri Health, Kisii County Government. Today, Your Excellency, we are humbled to host a very important workshop whose main objective is to look at reproductive health with a specific focus on maternal and neonatal deaths. 2 years ago, was able to sign a memorandum of understanding under the able leadership of His Excellency the Governor of Kisii County and his government. We signed an MOU with Jacaranda Health and Think Well, and that MOU had very clear objectives, which was basically to address the maternal and neonatal deaths, and also look at holistically our systems that are supposed to be addressed with the sole purpose of improving our revenue collection. I want to confirm that today, as we speak, we have been able as a county government of Kisii to reduce drastically those deaths. Kisii County, in terms of maternal deaths, we stand at about 30%, and neonatal deaths we are at around 12%, to speak, which is a great achievement. And more efforts and resources are being put towards reducing the same, so that we are at par with the dictates of WHO.
Paul Musila Waziri for Kweni County, and I want to state as follows. For us to make any impact as a country, not as a county now, as a country, in the statistics that we have, when we are talking about maternal mortality, mothers dying because they are carrying a pregnancy of 350 going to 400 times per every 100,000 pregnant mothers. When we are talking about babies, neonatal mortality, babies dying, newborn babies who will not see their first 30 days of life, out of every 1,000 born, 21 will not get to see that milestone. Then we have to come together.
Through this project, we've managed to reach around 18,000 pregnant women who are given short messages through their phones, and actually empowering them to know what are some of the danger signs so that they can seek healthcare service early enough to prevent maternal deaths. We've also been training through mentorship some of our healthcare providers. We've managed to reach 72 who are being mentored so that they can actually be able to adequately manage obstetric emergencies when welcome.
I'm the country director at Jacaranda Health, and for me, really, it's a pleasure to host the 3 counties here in Kisii, and we thank the leadership of the Kisii government, led by the CEC. We are supporting the 3 counties in implementing the Kenya Quality Ecosystem, where we're looking at improving the health systems towards addressing the barriers that are associated with high maternal and neonatal mortality. So we are looking at how we can improve issues around how mothers can access services. When they go to the facilities, having an opportunity to receive quality of care services, addressing issues around referral and access to blood, which is really important. Additionally, we are also supporting the counties to understand and look at the data critically, because that data is important to help them prioritize where to allocate resources for the interventions. But additionally, with our partner Think Well, looking at how can counties optimize the resources they get from the health insurance fund.
Thank all of them for having ensured that our maternal mortality rate and the neonatal mortality rate has been reduced. Because the intention of every government is to make sure that deaths don't occur. And as trained healthy professionals, with the support of government, they have ensured that they have reduced the mortality rates to acceptable standards. Our request this morning is to ask them to reduce it further. You know, when mothers are safe, when mothers are happy, the entire society is happy. When kids are born and they're able to see their 30th day, that's the happiness of every mother and the happiness of every family. And as they strive to ensure that this is done, we want to encourage them to make sure, as professionals, minimize those deaths as far as possible.
Vividly on the best ways of working together in the 47 counties so that we are able to bring down those deaths.
Inquiry, Jacaranda, Council of Governors, Ministry of Health, and other represented organizations, we started talking 2 years back, and we can actually report progress. I can report that from Makueni County, we have seen significant decline in the maternal mortality, especially the facility-based maternal mortalities, both for the last 2 years. Makueni County we've been able to strike it off, and this has given us some very interesting insights into what else was actually causing these mothers to die.
We can actually improve in terms of healthcare financing, and our main focus is actually to optimize on SHA. We've actually increased the registration for SHA as a county, and we are also doing digitalization to ensure that we actually maximize on the funds available to be able to manage this.
Improved our health care systems in terms of workforce and the physical facilities and the infrastructure. We have already promoted our doctors, and I'm sure they know, our clinical officers, our nurses, and all our healthcare workers. That is to aim and ensure that our services are properly rendered to the satisfaction of the people of Kisii County.
The uptake has really been good. So we do have an SMS platform known as Prompts, which basically is a two-way SMS platform that empowers mothers with information to ask them to go to the facilities earlier, when they experience issues during their pregnancy. But additionally, the platform enables mothers to ask questions at their comfort of their home. It's SMS based, it's free for the mothers. So really, for the last 3 years, 2 years we've implemented the Kenya Polytechnic system, we've seen an uptake of these services. We've currently registered around 56,000 mothers in the 3 counties and looking at registering 16,000 new mothers. So this is really an opportunity for us to empower mothers with information so that they can go to the facilities earlier as they seek services, and when they go